Hello everyone, this is Sakshi Sharma. Welcome back to my channel. So in our prior videos, we have discussed about the client need areas. So today I'm going to discuss about the another one, which is named as psychological integrity. So in your Nclex RN exam, 6 to 12% of the chunk will come in your Nclex RN exam. So what is psychological integrity? So from the word psychological, we can understand that as a nurse in your exam, we have to maintain the spiritual, mental, emotional well-being of the client, right? Client and the family members. So there are some key factors which will be involving in this, factor. So we will be discussing. So let's get started. So first is abuse and neglect. So guys, either flag this key point or mark it like Nclex RN important, because Nclex loves abuse and neglect. So abuse can be of any kind, like domestic, child, elder, sexual. Sometimes we have to suspect that it's a victim of abuse. So as a nurse, you have to provide the safe environment and tell them about the escalation plan, right? Escalation plan is, right, so for example, pregnant lady is suffering from domestic violence, right? So as a nurse, you can guide her that you can pack your important documents like your passport in your separate bag, and when something happens like that, so you can just take that bag along with you and escalate, right? So these are some important key points, but we will be discussing once our syllabus starts. This is just an overview, like what topics fall under this category. Then we have is behavioral interventions. So behavior modifications to decrease anxiety, support group participation, client response to treatment plan. So sometimes, if the client is undergoing under the major surgery, so sometimes they get agitated, they get frustrated. So as a nurse, it's your duty responsibility to modify the behavior of the client, your family members, right? They can join some support groups. You have to educate them. Third is chemical substance abuse disorder. So guys, this is also the important point for your Nclex RN. Nclex loves substance abuse, right? So dependency, withdrawal, nicotine, opioids, sedative toxicity, alcohol dependency. So these are some topics which fall under this category. So substance abuse can be done by the healthcare team as well. So sometimes Nclex throws questions like, for example, you find a nurse, she's doing opioid overuse in the washroom, and you have confront that situation. So what the nurse will do next? Either she will inform the regulatory body or she will follow the hierarchy. Maybe she will be telling the nursing supervisor about the situation. So these kinds of questions sometimes come in your exam. So Nclex loves this substance abuse. Coping mechanisms, use of defense mechanisms. Assess client's reaction to acute chronic mental illness like anger, rationalization. So coping mechanism means how the client is coping with the situation. Use of defense mechanism, right? So there are many defense mechanisms. Once we will start the syllabus, we will study about them. Identify situations that may necessitate role changes to client, like spouse with chronic illness, death of spouse. So these are some conditions, sometimes these can lead to anxiety, stress among the client or their family members. So as a nurse, how you will educate them? Like sometimes, they can display anger in front of you. Sometimes they can do rationalization that why this thing happens to me always, right? So these are some key points which always should be focused, right? So we will be discussing in another video about the coping mechanisms. So defense mechanisms, and this we have discussed about the defense mechanism, that how the client and family members use the defense mechanism, how you will educate them, how you will recognize that they are using defense mechanisms, right? So sometimes if unfortunate situation happens, they will maybe deny the situation, then they will be doing the anger, and they will be doing the bargaining that why this is happening to me. So these are some key points, right? Like sometimes they can they will be going into the grief because of the loss and all. So this is completely normal, right? So as a nurse, you should be competent in such fields. Then is crisis intervention, safety precautions, social supports, assess clients in crisis if something happens, like unfortunate that maybe there is a crisis undergoing. So as a nurse, what are your responsibilities, right? Cultural awareness. Nclex loves cultural awareness. This is also an important topic for Nclex RN. Incorporate client cultural preferences in client care. So as a foreign trained nurse, Nclex doesn't expect that you should be competent in each and every culture, but as a nurse, so you should be respecting each and every culture. And if you're planning a care for the client, you should always ask them that is there anything we should be taking into the concern, right? Any rituals which should be performed, right, according to their needs and desires or their cultural preferences. So cultural awareness is very important for your Nclex RN. So sometimes they will give you the question which will be focusing on the cultural awareness. End of life care: identify end of needs of clients like financial concerns, fear, role changes, assess client's ability to cope with end of life interventions. So sometimes maybe client is we can say that they can have end stage terminal cancer, right? So what are your responsibilities, how you will educate, right? So maybe client can have fear in them, right? So client maybe have lack of knowledge, right? So as a nurse, how you will guide them. Family dynamics: assess barriers, stressors that impact family functioning, meeting client care needs, divorce, participation in group and family therapy. So that's common, pretty much basic. So we have to sometimes guide them to the family therapy, in which they can have a meeting and they can discuss their concerns, right? They can have a family discussion, right? So sometimes maybe someone is getting divorced from their spouse, that can also create a barrier in their client care. So these are some things or circumstances. There are some circumstances which you should be concerned, right, which you should always keep in your mind while preparing the care for the client. Then is grief and loss. We have already discussed this is actually a completely normal process, the grief and loss. So we have to evaluate client coping, that how well the client is coping to the situation, and fears related to grief and loss. So that's completely normal. As a nurse, you will guide them, you will allow them to participate in some support groups, the group therapies, right? So by which gradually they can accommodate to that situation. Mental health concepts: impaired cognition assessments, memory loss, poor hygiene, schizophrenia, bipolar, depression. So assess client adherence to treatment plan. If someone is having such mental conditions, like for example mania, right, the client is hyperactive, right? So we have to sometimes give the task according to their disease pattern, right? So these are some concepts which should be always kept in mind. Like if client is suffering from any mental health condition, it will be not possible that the client will be adhered to their treatment plan. So we have to go through some process. We have to plan their care in that way that so the client can be adhered to their treatment plan, client understand their treatment plan, right? We have to be very patient with them. So religious and spiritual influences on health: we know that every person have their different perspective according to their religion and their spiritual needs, right? So we should always be ensured that their spiritual needs are met, right? For example, if they if they have to do a spiritual task in the hospital, so we have to discuss those concerns with their other managerial or other healthcare team staff, so that then the ritual can be done, right, in the hospital setting, so the client doesn't feel that their religion has been disrespected. So these are some things which should always be kept in mind. Assess psychosocial factors like occupational, spiritual, environmental, financial affecting client care plan. So these are some key points which always should be kept in mind, that for example a person doesn't have a job, so maybe he is under stress that how I will pay for my financial, like how I will be overcoming with my financial burden, right? How I will get the treatment, right? So these are some key factors which sometimes affect the client care. Sensory alterations: so provide appropriate care for a client experiencing visual, auditory or cognitive alterations. So sometimes a person cannot see, right? Person cannot hear, right? Any sensory other alteration, right? So patient or a client can become agitated, they can become frustrated. So we have to be very patient. We have to sometimes use the audio visual aids like pamphlets, videos. We have to give them pen or paper, or we have to use a sign language so that they can feel comfortable and we can incorporate the good client care with them. Provide reality-based diversions. Always identify time, place and stimuli surrounding the appearance of symptoms. For example, client have an accident, right? And now they are not oriented to time, place and situation, so we have to do the mental health assessments for them, that either they are oriented to time, place or situation or not, right? So these are some important key points in this one. Stress management: assess stressors including environment that affect client care, like noise. Sometimes, for example, a client is sitting on a couch and he heard a noise from outside and he just suddenly jumped onto the bed, right? So we have to ask that client that, is this the something which I should be concerned of? Like, does it happen to you first time, or you have experienced it before as well? So we have to be, use the active listening with them. We have to be non-judgmental with them. So these are some things, and we have to implement measures to decrease the anxiety, right, among them. Provide education, like we can use relaxation techniques, meditation, music, guided imagery, right? So these are some techniques which can be used to incorporate the good client care. Last is therapeutic communication. Nclex loves therapeutic communication. This is also, I think you will get one question in your exam on this. So what are the therapeutic communication techniques? This is also a separate topic which we'll be discussing it in the other videos. So therapeutic communication means active listening, like maintaining eye-to-eye contact with the client, right? You nodding your head that yes, you are listening, right? You should not use the closed-ended questions. Always use open-ended questions. Do not use why-ended questions, like why you always feel like that, why you are the only person who feels like that, right? Because this can be derogatory to the client, and then the bond between you and the client can not be maintained, right? So client will feel uncomfortable, they will not share anything. So as a nurse, you should be competent in therapeutic communication so that the client can share their concerns, and then appropriate knowledge or guidance can be provided to them. So these were all the key factors. We are just discussing this point because, then if unfortunately you get fail in your Nclex RN exam, you should know that 6 to 12% of chunk where I was lacking. Some, like in your report sheet, they will be saying that it was below the passing standard. So you should know that, okay, these topics were under this category. So maybe these were my weak point. I need to study or I need to revise them again. So here I have a sample item for you, so we can practice it. The nurse is talking with the client who had a colostomy created 2 days ago. Which of the following statements by client would indicate ineffective coping? So guys, this is the thing which I want that you should focus. Many of my friends and students, they get confused. So sometimes they will be picking because in the exam they are anxious. Sometimes they will think it's asking effective coping. But the question is asking, always focus what question is exactly asking. Question is asking, the client states ineffective coping. That means client have not dealt with situation. Client is not accepting the situation right now. It's a SATA question. That means select that all apply. So in SATA question, it's not mandatory that only one option should be answered, or maybe more than one option is an answer, right? So if you think that there is only a single item which is relatable to this question, that you think that only this answer is correct, that can also be a SATA. There is nothing like that, that if it's a SATA question, you have to pick more than one option. So this is the confusion which most students, face. So the question is talking about the colostomy. First, you should be acknowledged that what colostomy is. So colostomy means, so we have, a large intestine. So large intestine, we have ascending colon. So this one is your ascending colon. Then this one is your transverse colon, and then the way which come downwards is your descending colon, right? So if you cannot remember, ascending means, increase, so upward. This is your ascending. Transverse means straight forward, and then just bend down and coming downwards is your descending colon. And then is your sigmoid, rectum, anus and appendix. Appendix doesn't do anything in our body. So this is your large intestine. First we are going to discuss what colostomy is. So what will happen, maybe what happens is your surgeon dissects this much of area, like this is a triangle which I'm drawing. So this is the dissected part which has been dissected, right? So the surgeon removes this much of portion. So now what colostomy is, this area will be adjoined by this area, so this will be removed, right? And here the stoma will be created. Stoma is a hole or an opening in your abdominal wall so that the waste from your body can come outside. And on that stoma, suppose this is your stoma, on that stoma a bag is, a pouch is sticked, which is known as colostomy bag, in which that waste can get accumulated, right? So that's colostomy. Pretty much, simple, which is like, this is just a definition of colostomy. Like, some portion from your intestine is being dissected and those two ends are then joined, right, where the obstruction is fine. For example, there was a bowel obstruction here, right? So maybe the client is having inflammatory bowel disease, so there was an obstruction. So that part will be dissected, and then these two endpoints will be joined through an opening, through a stoma, which is known as stoma, and then the contents from the body will be coming outside from that stoma, and where those contents will be going in the pouch, in the bag, which will be stick to on the stoma. So we have the options now that we will be talking, that like what the client did not cope, right? So again, I'm reading the question. The nurse is talking with the client who had a colostomy created 2 days ago. Which of the following statements by client would indicate ineffective coping? Ineffective coping means client did not cope with that situation. Client is still not accepting that he or she is undergoing the colostomy. Option A, I am not touching that disgusting bag. This is pretty much straightforward. Client said, I'm not touching that disgusting bag, right? So means client does not want to touch that bag. Client is not accepting that he or she is having colostomy. So that's the answer, which indicates that it's an ineffective coping. Option B, I'm glad I can still go to the gym just as I used to. So yes, for even if you are having a colostomy bag, you can do your day-to-day normal activities. That's not a big deal. So that means client is saying that yes, I'm glad that I can go to gym. That means client have understood, client cope with that situation. So this is not an answer, because here we are looking at what is ineffective coping with the client, right? Option C, I really like raw vegetables and it will be hard to limit them. So if you like, now we are not knowledgeable with this topic, but here I will just help you guys that why the raw vegetables we have to limit, because raw vegetables contain fiber. So we should avoid those things with the colostomy which produce gas, or which produce your gut motility. So fiber induces gut motility, so we have to avoid the raw vegetables. So in this option, the client says, I really like raw vegetables and it will be hard to limit them. That means client understands that I have to avoid, or I have to limit the intake of raw vegetables. That means client understood. This is not an option, because client understood, client is able to cope. Option D, I understand the need for colostomy, but I'm afraid the bag will leak. So client says, I understand the need for colostomy, but I'm afraid the bag will leak. So client is having lack of knowledge. So that doesn't mean the client is, not accepting the situation, right? So the client is not coping with that situation. Client needs knowledge. Client needs health education about that, because if the bag is half full, or if the bag is 1/3 of full, of course the bag will tear it out and the bag the content will get leaked, right? So but the client understands, so that's not an option, right? So this means the client understands the need for colostomy, client effectively cope with that situation. Option E, I do not understand why cannot I have a nurse perform the colostomy bag changes for me. So client says, why the nurse cannot do the colostomy bag changes for me? That means client doesn't want to incorporate in his or her colostomy bag care or the procedure. He wants nurse to do it every time. That means client did not effectively cope with that situation. Client is still asking others for doing that stuff. Client is still not coping, like client is not, we can say that client is still not coping with that situation. Client is saying that, my god, why colostomy is being done on me, right? So client is still afraid, right? So E is the option. So here answers are A and E. That means these are the options which states client still not effectively cope with the situation. Client is still under that dilemma. So guys, this was just superficial discussion about the psychological integrity and how the question comes. See, this was discussing about the psychological mind, like is the client ready for the new stage in his or her life that he or she have to be with colostomy bag, right? So these were some key points. I hope you like this video. Please share with your nursing peers any recommendations for me if I make another video. Like if you want anything specific, please feel free to share that thing. Thank you for